Hey, welcome back to Not So Complicated, and today we'll be talking about laboratory diagnosis of almost all gastrointestinal parasites in microbiology. Let's begin. So, in the overview of the video, these are the parasites that we'll be covering: Enterobius, Ancylostoma, Trichuris, Echinococcus, Hymenolepis, Ascaris, Taenia, Entamoeba, and Giardia, right? So the procedure is standard, obviously. First of that is sample collection, followed by concentration methods wherever required, followed by wet mount preparation, followed by direct microscopy, and then we do the observation in that direct microscopy in different magnifications, right? So like 10x magnification and 40x magnification. Let's talk from sample collection. So there are two kinds of parasites. If we broadly divide them, these are intestinal and extraintestinal. And talking about intestinal parasites, obviously the sample is either stool or vomitus, and these are the organisms right here. And Entamoeba here can be present in extraintestinal parasites also, because it causes extraintestinal manifestations like liver abscess, right? So in liver abscess cases, Entamoeba is extraintestinal parasites, and the sample for these cases is either cystic fluid or abscess fluid, right? So these are the samples that we have to collect. So what is the method of the collection of these samples? Talking about that, so stool or vomitus, how do we collect the stool? Stool is collected in the case of Enterobius vermicularis, that is cellophane or scotch tape swab from perianal region early in the morning before washing or defecating. So we do the rectal swab in the case of Enterobius vermicularis, and stool is not diagnostic in this case, but for all other parasites we do fresh morning stool sample collection in a clean dry container for 3 consecutive days, and it should be positive in 3 consecutive days, right? So that is when we prove that the patient is suffering from that particular parasite. So but in Enterobius vermicularis we do the perianal region swabbing, that is rectal swab formation, and that is the sample for us, right? So in liver or hepatic cyst we do the obviously cystic fluid collection from pair technique, and pair is puncture, aspiration, followed by injection, followed by re-aspiration, and USC or CT findings are diagnostic in these hepatic cyst or long cystic or liver cystic cases, right? So this is how we do the sample collection. But what happens is not always these samples are enough, and the indication for concentration methods is that whenever parasite load is low, or for intermittent shedders like Giardia or Trichuris and chronic infections, and also to examine preserved stool as in 10% formalin fixed cases, we do the concentration methods. And there are a lot of techniques. Out of that, 2 of them are flotation technique is first, and then the procedure for flotation technique is that we have to mix the stool with flotation fluid and centrifuge or stand that, and then collect material from the surface layer, and this is for light materials or light eggs, right? So what is this flotation fluid? Flotation fluid can be zinc sulfate solution, which is most commonly used, and also saturated NaCl, and that will, this procedure, we have to observe cysts in the Giardia and Entamoeba cases, and light eggs in Hymenolepis and Hucon cases, right? So this is when we do the flotation technique for concentration method, and the other technique is sedimentation technique, and in this case like heavy eggs are observed. So the procedure is that we have to mix a stool with 10% formalin, then filter and add ether or ethyl acetate and shake and centrifuge and remove the top 3 layers. In flotation techniques we have to remove we have to collect the surface layer or the top layer, but in sedimentation case we have to remove the top 3 layers and collect the bottom sediment, right? So that is the diagnostic stage, and what we observe is heavy eggs as in Ascaris and Trichuris, right? So these are the concentration methods. The third step is wet mounting of the sample. We do the wet mount. What do we do is gently resuspend the sediment using an applicator stick, right? So we have to ensure that there is even distribution of parasitic elements, and then we place 1 drop of concentrated specimen that we do like that we did right before, right? So we will be placing that 1 drop of concentrated specimen on clean glass slide. Then we do 2 mounting. One of them is saline wet mount and the other is iodine wet mount, and in saline wet mount we do add 1 drop of normal saline and then observe motility as in Giardia case, and also helminths and eggs. But in iodine wet mount, what we do is adding 1 drop of Lugol's iodine, and that will stain cystic structures or internal structures of the parasites, right? So after doing that, we will place a cover slip over that and then observe on 10x or 40x microscopy, and then this is when we are looking forward for microscopic findings specific to the specific parasites. So this is the table and this is all you need to remember, and I have tried to make a mnemonics out of here. So in Enterobius vermicularis case, E for Enterobius, E for egg with E for embryonated larva, D set, that is planoconvex sept, right? So in Ancylostoma duodenal, microscopic finding is A for Ancylostoma, A for active blastomeres of 4 to 8 cell ovum, and in Trichuria, there is like T for Trichuris, T for torpedo shape with T for 2 plugs, and in Echinococcus granulosus is elements in cystic fluid, not egg, and hydrated sand is it. And then Hymenolepis nana, it is hooked oncosphere and hairy polar filaments. Polar filaments are present only in Hymenolepis nana, and in Ascaris lumbricoides, albumin coat, atypical size, that is amorphous size in unfertilized egg, and in Taenia species there is thick cell, triple hooks, and radial striations. In Entamoeba histolytica, there is erythrophagocytosis or encysted nuclei, that is 1 to 4, and in Giardia lamblia there is ghost face like trophozoite with gaggle of flagella, right? So notice that bile staining is positive in Ascaris, Trichuris, and Taenia, and then there are motile trophozoites in Giardia and Entamoeba. This is all that you have to remember in the GI parasitology. I hope it helped you a lot, and please subscribe for more, and thank you for staying until now. Thank you.